Okay. Hello, everyone. Welcome to Scars and Scriptures. I'm Crystal Summers, of course, and this is to Felicia. We'll go ahead and start with you just introducing yourself.
Okay. Yeah. So, like Crystal said, my name is Felicia. I'm a functional medicine practitioner. I know we'll talk more about what that means. And I am the owner and founder of Functionally Balanced Health, which is a virtual functional medicine practice that cares for people in the state of Tennessee and Florida. I work specifically with Black women. Who are suffering with autoimmune conditions, autoimmune symptoms, not sure, what these strange symptoms are. I work with them to get answers to what's going on in their body, help them towards relief and just getting back to that life that they used to live, that they love, that they feel like they would no longer be able to live again.
I love that. I know for me and a lot of my friends Black African American women, we are constantly looking for medical providers who look like us, and specifically Black women, just because there is this disparity when it comes to our health and listening to us. And so it's always great to find doctors who specialize with Black women, but also look like us. So that's
Right.
always exciting. So if you can explain to us though, what's the difference between functional medicine and conventional medicine?
Conventional medicine is just like what you get typically from your primary care doctor. So you go in, the whole goal is really to give you a diagnosis. You go in saying you have XYZ symptoms. We're trained in school to put a label on those symptoms. And then based on the symptoms, based on research and evidence, these medications are good for those symptoms. So it pretty much stops there, giving you a diagnosis and giving you medication or doing some type of surgery or doing some type of radiation. Like those are all treatment approaches from a traditional medical doctor. Functional practitioners do a little bit more of a deeper dive. Our whole goal is just to get to the underlying root cause of why are you experiencing this. So we go through a lot of questioning with you, looking at your overall, just not medical history, but your environment, your toxins, your relationships, your movement, your diet, really trying to understand. And then it is science based. So we do a lot of labs, do some advanced testing that your traditional doctors won't do. So sometimes we may look at your gut, do some stool testing. We may look at, what kind of toxins have you inadvertently come in contact with. We may look at some food sensitivities, look at your hormone balance. So that's the main difference. Just trying to get to the underlying root cause and see why is your body out of balance.
So when you say toxins, what toxins are like? What's our normal toxins that everyday people are running into?
Yeah, one is mercury. So many people have like mercury fillings in their mouth and don't even realize, like, if that's not put in properly, that mercury is seeping throughout your body. And even when you get them taken out, they're supposed to be, I mean, a regular dentist can remove them, but if they're not removed by, they call them a biological dentist, or a functional dentist that actually remove them properly, that mercury can continue to, seep throughout your body and cause a lot of issues. Then, there's like chemicals and toxins in water, depending on where you live. There may be, lead in your water, there's lead in, paint in old homes and things that we don't even really realize. You could have mold in your home. Maybe you had some water damage and not even know that you have this mold that's impacting you in your home.
Yeah,
So,
no, that actually happened to one of my friends. She got really sick, and like they couldn't figure out what was going on with her, and it turned out she had
yeah,
mold in the walls, and it was making her like very sick. And, I mean, it's things that you don't really think of. You like, I think toxins. I'm like, you think the green goop that's in the big can that's waste or something, but like these
mhm.
are kind of like everyday situations that you just don't think
Yeah,
about.
yeah. Even our regular like household products and hair care products and things that we eat, even foods. Now they're looking more at, I know they're removing the red dyes, but there's various chemicals and toxins. And
That's so crazy. My sister, like I want to say a year or two ago, got really big into like the red dyes. She has kids, and so the first two, they was eating the gummies, and now she's like, such red dye. This is blue dye, and like it's like I feel like it's all the craze now, which is good.
Right.
I mean, I have never really done any much research into the different dyes, but they say it's bad. So that's all I got. And they say it's bad. So what led you to practicing functional medicine? Like, it's not something that you hear about a lot. It's just kind of, I feel like over the past year, I've been hearing more about functional or holistic. And is it the same as holistic? Like people kind of use it interchangeably.
I feel like functional medicine falls up underneath holistic. So holistic to me is like looking at the whole body or looking at the mind, body, and spirit. And functional medicine falls up underneath that. But I feel like functional medicine does more of those type of advanced testing. So it's more scientific, science-based, and things like that. It's not talked about. It's not the typical training that we get in schools as nurses or doctors. Some programs are offering training more now on holistic medicine or functional medicine. I learned about it from social media and decided to do some of my own research. I've always been drawn to preventative, asking why did this person develop this disease or this condition? What could we have done to prevent this to begin with? So when I learned about functional medicine, it just totally aligned with like my own beliefs and thoughts. And I decided to, okay, I'm interested. Let me do a little bit of research and look into this more. And how can I learn more about this? Because I didn't learn this at all in school. It's a whole different way of thinking, a whole different approach outside of, not just, okay, let's listen to the person. They say they have these symptoms. Oh, it's this. It's really digging deeper. But yeah, I learned about it on social media. And I just was intrigued.
Social media, man. It be coming through.
Yeah.
I mean, that's where so I have a condition called hidradenitis suppurativa. And when I got diagnosed, I didn't know anyone with it or people who ever heard of it. And it wasn't until, and I got diagnosed at 12, and it wasn't until I was 28 that I saw someone virtually on social media. And I was like, her skin looked like mine. And then, she was talking about it, and I was like, so I'm not the only person in the world with this condition. And, and then the algorithm started feeding me people, and I was like, it was eye-opening. Like social media, we'll plug for that. A lot to be learned.
Yes,
So when someone comes in with like a condition like hidradenitis suppurativa, how do you work to identify the root cause?
So we do a lot of the questioning, like I said. We looking at their overall just history in general, toxins, diet, lifestyle. And then we could do a deeper dive by looking at, is there something going on in their gut? Maybe they're not having some balance, good and bad bacteria. Maybe they have a lot of inflammation in the gut that's leading to inflammation elsewhere in the body and them having their flares with the HS. We look at testing like, are their hormones imbalanced? So yeah, everything would just be drawn by looking at that underlying history with the patient, and then from there deciding what kind of testing do we need to do to take a deeper dive and to see if this is contributing to, what you're experiencing with your HS.
Definitely. And I feel like gut health is like, again, with functional medicine, I feel like it's all the rave that I'm hearing now, like gut health, gut health. How does gut health, why is it the starting point with functional medicine?
Yeah. In functional medicine, we say like disease begins in the gut because everything is connected. So much is connected to the gut. We really don't realize that, but it is like the gut is connected to our brains. You might have heard the term of leaky gut, where if you don't have a really built up good intestinal or gut wall barrier, things can leak through. There's also something called leaky brain. There's something called leaky lungs that people
Never
don't
heard of
talk about.
those.
There is a connection with your gut and your hormones. So, like, that's typically the first place that we look because disease begins there. And healing can start there too. Healing can start in the gut. So, that's a lot of times a place that we look.
That makes sense. So, how would someone know that their gut is causing an issue with their skin? Like, what is something that they would notice? What would be like the first signs to be like, okay, it's my gut, and how do I fix that?
Yeah, you may not even realize it until maybe working with someone, digging a little bit deeper. And when we do our advanced test, looking at the gut, looking at it's through a stool sample at home test where you have instructions on how to collect your stool sample. We'll send it out to a lab and look at it, and it can show us if you have inflammation there. When inflammation starts in the gut, it typically can become systemic, and that may cause inflammation elsewhere and lead to the inflammation that is correlated with, HS. So sometimes you just don't know until you dig a little bit deeper.
No, that makes sense. Like, can you explain, I guess, the connection between the gut membrane and autoimmune like conditions?
Yes. So 70 to 80% of your immune system is within the gut. And so if that gut barrier wall isn't built up as it needs to be, there's just a single layer of cells there. So if that single layer, it's the layer of like mucus underneath it as well. If that's not built up and things are seeping through that layer, it's getting in contact with the immune system, and the system sees it and thinks maybe it's something going on. I need to protect this person. Maybe this is a foreign invader or some type of threat. And the immune system acts by causing inflammation. So you can, like I said, have inflammation there in the gut, but then it can spread elsewhere throughout the body. And so that's why I think you asked me about how does that relate to autoimmunity. Yeah, so
The
that's why
connection between that and autoimmune disease, yeah.
so a lot of people have that quote unquote leaky gut who have autoimmune issues. That's an autoimmune condition is when your immune system is going into overdrive. I won't say it's attacking your body. It's just doing what it's thinking it needs to do to protect you, but it's just going a little bit too far, and it's causing these symptoms that you may be experiencing, whether it's joint pain or whether it's brain fog or whether it's just digestive issues, the bloating, the constipation, or even diarrhea.
So is there
That's
like
how it's.
food to fix that? Like, okay, I mean, if it's my gut, then I assume it's what I'm eating. So
Yeah,
what do I do to fix it? Like, do I need to like eat prebiotics, probiotics? I hear a lot about that. I watched a little Netflix special. I went and got a bunch of probiotics and prebiotics and started drinking some juice. But like,
yeah.
is that basically it, or like, is there something else that you need to do with your gut?
There are foods, like you said, you can do more anti-inflammatory foods. You can do more, less processed foods, more whole foods, your fruits and vegetables. You can do like berries, which are great in antioxidants. They're great anti-inflammatory um, foods as well. You can do like, your prebiotics, probiotics, like you said. So some people think about like sauerkraut as a prebiotic food, or kefir. Some people think about I was talking about this with someone the other day. Prebiotic foods can be like your not completely more green bananas. So there are different foods that help for sure. There are different supplements and things that you can do, herbs as well, that help build up that intestinal wall, and support that gut lining. So things like aloe is really good. There's something
Anybody who
called
watches me know I love aloe.
marshmallow root or licorice. Not the same licorice that like what we eat, but
I
yeah,
was like, I
these
can do
are
that. I can eat some licorice.
yeah, these are different supplements and herbs that we can use to help build up that lining, support that gut lining.
Okay, no, that makes sense. So, do you lean more towards supplements, or like does it really matter? Is one better than the other? Because I feel like supplements you're going to get more bang for your buck as far as like all the vitamins or whatever you need versus eating a bunch of different foods. But is there one that you lean to over the other?
With me, I guess it really depends on the person that I'm working with. Supplements, some people take supplements or vitamins and just stay on them long term. And all vitamins and supplements aren't meant to be forever. They're only meant to be for a certain time. Also, I know people who, look at functional medicine practitioners and feel like, why should I go to them? Because all they're doing is replacing my medications with supplements. For me, I feel like it's kind of like a way to provide some quote unquote rapid relief, right? Like while we're still working on changing your diet, because you're not going to just change your diet overnight. If this is something that you're used to eating, this is something your culture, enjoys too, it's going to take time to make those adjustments. So starting with supplements, if the person can afford them, because they can get costly, if the person is willing to try supplements, then yeah, I would love to do that while incorporating those other changes as it relates to nutrition. So I like to do both, but it still depends on the person and kind of what their thoughts and preferences are. That's the thing about functional medicine. We're always including that patient into the decision and treatment plans. We're working as a team, right? It's a partnership. It's not me dictating to you and telling you need to take this medication, you need to change this about your diet, and you need to take this supplement. And it's very personalized. So what works for one person may not work for another person. What's recommended for someone else, I might recommend something differently for the next person.
No, and that's a big thing because I feel like, especially in the HS community, someone will have something work for them, and that's great. But then they're like,
Yeah,
"That's it. That's what you need to do," and it's like, well, it's not going to necessarily work for everybody because like
yeah,
our triggers are different. What's going to help us is different, and so I feel like sometimes warriors, doctors, people just get in their mind like this is the way to do it, and it's like not everybody's body going to respond to the same thing the same way.
yeah. And I can get it too. Like if you've been struggling for so long and then you finally, first of all, you feel like you're the only one that's going through this. You're very isolated. Then you finally find someone else who's going through it. And then they say, oh, this is what worked for me. You might feel like, oh, I've got to do this. This is what's going to work. It worked for them. It's going to work for me. And you might feel defeated or, just let down if you tried and it doesn't work. But yeah, everybody is different.
Oh, definitely.
Yeah.
So, is there a balance, or do you let's see, can functional and conventional medicine work together?
Yeah. It definitely can. Because there's still times where you need medication, right? Conventional medicine is just giving you medication and not digging a little bit deeper to the root. There's times with various autoimmune conditions, of course, it can affect a number of your organs, and you may need medications. You may need surgery. You may have lupus nephritis and be at a point where you need a kidney transplant. Um, I'm not opposed to medication at all, and I feel like they work very well together. Um, Again, it depends on the person and their situation and what their preferences are. If they are able to be off of medication, that's great, but some people aren't able to, be off of medication completely.
No, definitely. I think that is, and that's what the thing I want to like really touch on, like, because I personally don't do medication, but sometimes I'll talk about medication because like I want people to know that. I
Yeah.
mean, there's a broad spectrum of ways that you can go to try to live your best life. I talk a lot
Hmm.
more about food, and I'll be honest with people. Some days I eat right. Some days you'll see me making a
Yeah.
video about eating cheesecake.
Yeah.
It's where I'm at in my journey. Be
Yeah.
better than listen to what I say, not what I do, type thing. but like no, I really like that the balance, because I feel like medicine for some people, lifestyle change might be too hard. And like I said, I have a friend who said we get to choose our heart. And for some people, I hear all the time, they're like, I can't give this up. I can't, culturally, you were just talking about, like, I'm at a girl comment. She's like, I'm Mexican. Like, I got to eat salsa and I got to eat, X, Y, and Z. This is just kind of who I am. And so that can
Yeah.
be hard. And, there's medicine for that. You can do a little bit of medicine and a little bit of changing up your dietary or, lifestyle. But I definitely agree that there can be a balance between it, or you can choose to go completely one way or the other. But
Right.
a
Right.
little
And
personal
then
choice you got to think about.
yeah. And then sometimes you have to just really, someone may say, oh, I can't give this up, but like talking to them and seeing, are they open to it? Have they tried some kind of alternatives, and trying it and seeing how they respond to it? How does their body respond? Do they feel like they're less flared with this change? Are they enjoying it? And then they may say, oh, I really can do this, So I'm thinking about the person who you said, just can't give up salsa. I know that's just an example, but yeah.
No, definitely. And I mean, for her, I made a video of making salsa that was nightshade free. And I'm like, you just got to
Yeah.
get creative with it. Because
Right.
there's a million ways you can make salsa. There's traditional, like it's tomatoes, jalapeno peppers, a lot of nightshades. But if you think outside of the box, you can still eat your favorite foods, just done differently.
Right.
And so with that though, like diet, I feel like is a huge aspect with any chronic illness, hidradenitis suppurativa, rheumatoid arthritis. Like people are always talking about like changing their food. And do you offer, or with functional medicine, do you guys actually do nutrition or dietary plans so that people can kind of, because I can be told, okay, you need to change what you eat, but are you going to help me with that process?
Right. Right. So, yes. So some people may have like a team working with them. It's only myself. Some people have like a nutritionist or a dietitian that works, as a part of their team. With it only being myself, I do provide like meal plans for a specific person, depending on, what their specific condition is. It's tailored to them and their needs. But I still, let it be known I'm not a dietitian, or, I don't have that training of a registered dietitian. But I do know I've studied with functional medicine, and part of that is looking at nutrition. And we know like foods that can be triggering to your condition and your symptoms. So with that being said, yeah, I do provide some guidance on nutrition. I welcome people, not just giving them like, okay, here's a plan, here's what you can eat for breakfast, lunch, and dinner, but really sitting down and going over it and looking at other options, maybe what works for them, what's something that can be, an option if they have a family, or, various, concern about price. And maybe you can't get the healthiest thing because it's a little bit costly, but we look at good, better, best. What's something a little bit better than what you're doing now? So I do try to provide people with guidance on nutrition.
I love that, good, better, best. Like, I mean, because it's just
Yeah.
a slight variation can make all the difference. I say this all the time that because I mean I don't eat right all the time, right? And so I'm like, the poison is in the dose. So if I can
Yeah.
change a little bit of what I'm doing, 2 out of the 3 meals a day, or 4 or 5 days a week, I eat listening to my body, and then I might have a day or two where I listen to my mind and heart and eat what I want. But like I can go without flares. But then there's some days, when you go balls to the wall, and then I'm like flaring. I'm like, okay, I did too much. It was too much
Yeah.
inflammation, right? And so like
Yeah.
I think of it, because inflammation is like the big thing with HS, that you might eat something that is high or inflammatory, but you don't flare. But I mean, if you do
Yeah.
too much of that, it's gonna build up. And so like it's like the poison is in the dose for me. It's like that's what I tell myself. Okay, you ate this today. We need to be better tomorrow. And so
Yeah.
just good, better, best. You're not going to jump off and automatically be like, what is it, API? What is that diet? That is the
AIP.
inflammation diet. You're not going to start
Yeah,
that.
AIP.
I mean,
Paleo.
somebody might just jump off the porch and start doing that cold turkey. But like for me, I'm like, I gotta work my way and cutting things out.
Yeah. Yeah, some people can do that cold turkey, but it's best, like you said, the more gradual transition into AIP or any kind of like change, because it's not supposed to be temporary. It's not a quote unquote diet that's just for X number of days or X number of months. It's really a lifestyle change. And ultimately, yeah, the goal is to cut back on these things as much as you can. But yeah, I understand if you have something on a certain day, then yeah, you don't want to go overboard, like you said. But yeah, it's a transition. It's not anything that can just be jumped into by many. You might have some, but most
Yeah.
can't just jump into it cold turkey. Yeah.
And I think jumping into a cold turkey is like might psych you out, because when you fall off, if you fall
Yeah.
off, and then you start weighing, becoming negative to yourself. Oh, like, oh, I'm
Yeah.
doing this, it's my fault. And then it
Yeah.
becomes victim blaming yourself, which is a whole nother
Yeah.
issue of like stress. Like, don't
Yeah.
stress yourself out. Like, do what you can as best as you can.
Right. That's true. Because you can feel like you failed. Like if you just have one day off and it's like, oh my, I failed. Like I can't get back on the wagon. And like now I'm having these flares. Like, yeah,
I mean,
it can
that's
be
like,
hard.
for me, like I'm one of those people, like I can't buy junk food or something to have it in the house.
Mm-hmm.
Because then like I'll eat a cookie and then I'm like, oh, I already fell off the wagon. So now I gotta eat everything right at once. And then it's kind of like
Yeah.
a whole period of self-loathing. And then I'm like, okay, I'm gonna
Yeah.
get back right. But like, if you kind of recondition your mind of like, I can have a cookie, it's not falling off the wagon. I don't have to then binge eat to punish myself and get rid of it. It
Yeah.
just, okay, you had a cookie, acknowledge that, you know,
Yeah.
move on.
Yeah.
So I'll do that. So speaking of, you talked about like, costliness of eating well, whole foods and stuff like that. Functional medicine. So I don't believe it's covered by insurance. Like, how can someone go about either, I don't know, getting it covered, or working with you guys and their doctor?
Mm-hmm. Yeah, so unfortunately, a lot of times it's not covered by insurance. Some people say that's good and that's bad because, a lot of times insurance can dictate what you're actually able to do as far as like treatments and things and testing. So it's not covered. Um, but what a lot of people do as functional practitioners is have their patients go and get labs done, their routine labs at their primary care doctor. Or, they may also send a letter with them and ask the patient to give it to the doctor, or send it to the doctor directly, just introducing who they are, and of course saying how we're so appreciative of this patient continuing to follow you, because we're not trying to take your place, but we're working together with this patient to better provide support for whatever it is. And ask them, would you be willing to do these labs for this patient, explaining the reasoning behind that so that they can, one, have an understanding, and then two, maybe be more likely to do it. That's an option. Um, Sometimes labs can be ordered and testing can be ordered and done, and then we provide something called a super bill, which is something that the patient can take to their insurance company and see if they will reimburse that service. Some practitioners, including myself, I really don't want finances to be a barrier, but I know that it can be. So I try to do whatever I can to work with you. So that might look like doing some type of payment plan, um, and spacing it out. Like some people are willing to do that as well, knowing that insurance doesn't cover it. So those are some of the options that most people do.
Okay. So what are, I guess, the type of tests that you guys would normally do? I remember I talked to someone who does functional medicine before, and they were talking about like like you can do like an inflammation test. And how do you, because I'm thinking as a person, with the condition going to their doctor, you go in and you try to talk to your doctor about, this is what I need. I think I need this test. And you mentioned it, that you guys will often send letters or referrals over to the doctor, which
Mhm.
I think is amazing, because it's hard enough going into the doctor's office and then trying to
Yeah.
find that medical mumbo jumbo to try to like
Right.
retort to them and be like, this is what I need. This is why I
Yeah.
think I need it. So I'm gonna two parts to this, I guess. Like, so I can't remember what the inflammation test is that you can order, because I actually want to try to get that done. But also, I want to touch on just how important it is to have a doctor or medical provider, who listens to you. Because I know a lot of warriors have told me like they've tried to get tests done and their doctors be like, you don't need that done. My own doctor did that. Like, when I tried to get some tests done, and he's
Hmm.
like, you don't need that. What's the purpose of that? And I'm like, sir, just run the test. Just run the test.
Right.
Because it ain't coming out of your pocket. You getting paid regardless. The insurance pay you or I pay you. You get paid.
Hmm.
Just run the test. But like a lot of times, doctors feel like, and I'm coming from a jaded place, so not all doctors are like that. Just kind of my experience. Like,
Hmm.
you follow me, I've had some experiences with doctors, and so
Hmm.
that they feel like they know best. I went to school for this. I know best, but I'm a firm advocate. Like, nobody knows my body better than I know my body. I don't care what you've
Hmm.
learned or what
Right.
medicine you've researched. You don't know my body. And
Hmm.
so being able to advocate for yourself, or having someone in the functional medicine space who's going to actually write that letter and advocate, like, this is why they need it, this is why this is important,
Yeah.
is so good, because like I said, a lot of times we don't have that language.
Hmm.
But going back to my other question, what is that test? If I don't know if I'm putting you on the spot, it's an inflammation test that you can test like the inflammation in your body.
Was it? I mean, it wasn't like a panel of just different
I
inflammation
think it might have been
markers, or was
mentioned, because with HS, like your inflammation. So I was like interested in seeing like where my inflammation is, when I'm not, when I'm in remission, at times when I'm in remission versus when I'm actively fearing, to see like where the
yeah,
inflammation is in my
yeah,
body. I'm
the
interested in
different.
that.
I really don't know what a specific test is. I know there's certain markers. Of course, a lot of people may have heard like ESR, the sedimentation rate, or CRP or homocysteine. Those tests aren't typically done by traditional doctors, but they are inflammatory markers. Um, Even things like your white blood cells can tell a little bit about your inflammation, or ferritin is your iron storage, can tell a little bit about inflammation. So there's different markers that we can do, but I'm not sure about, and that's not to say that there's not.
Markers. Maybe that's what she was saying. Again, this was a year ago. I heard this and I was like, inflammation. There's something that can be done that can tell me, about the inflammation in my body, which I think is interesting.
Yeah.
Don't know what
I
I'm gonna
mean,
do with it, but I think it's interesting.
so we have those, but then again, like I mentioned about the gut, it tells us about inflammation there as well. And of course, you getting the test done, you may not know what to do, but working with someone who is familiar with the test and who can read and understand the test, can give you options on, what to do from there, whether it's working on nutrition, whether it's implementing some lifestyle changes, or whether it's doing supplements or herbs. Um,
So when you say
but
because when I think lifestyle change, I really just think diet. What other lifestyle changes are you talking about?
lifestyle changes, like it could be incorporating movement, getting some gentle movement. It could be, we talked about toxins, so it could be maybe changing like some of the products that you're using that have a lot of those toxic chemicals. Lifestyle, of course, can be diet, like you said. Lifestyle is also like working on your sleep habits and getting in the bed at a regular time. That helps to get your hormones more in balance. It could be working on your stress. Of course, we all are going to have some stress, but long-term stress can really be detrimental. So trying to manage your stress, that's another lifestyle factor as well.
Speaking of sleep, like I struggle going to sleep. Like I think the last 2 nights I've gotten like 4 hours of sleep. Like I just, I don't know. And it's crazy because I be tired all during the workday. I be tired during my whole drive home. And then I get home and I got renewed energy. And then I'm up until
Mm-hmm.
midnight. And then my
Mm-hmm.
workday starts at 4:30 a.m. And so I get very little sleep. It's a vicious
Yeah,
cycle. So what can I do
yeah.
to actually help with that? What can we do to actually help with, going to sleep? Because
Yeah. Yeah, you want to look at the things that you are doing. Like when your body is, you're ready for bed, are you kind of winding down or are you still active? Like, are you watching something on the TV that can be triggering, like the news or an action movie? Like that could be telling your body, like, I need to sound high alert and not rest and, get some sleep. The blue light, of course, from your phone or computer, that plays a part too. Um, are you, sometimes our mind is just busy, we're constantly thinking, and that's going to prevent us from sleeping. So it's kind of like, what are you doing? What is your routine? What does your wind down or night routine look like? Are you preparing your body for sleep and letting your body know that it's okay to rest and relax and, get ready for bed? So a lot of times too, like cutting off the lights is big. Not eating. Most people say within 2 to 3 hours of going to bed, because your body will feel like, I need to be up and getting it, helping to digest that food. So what you're doing in those hours before plays a big part. Are you drinking any caffeine late in the day? Like really just thinking about things like that. Some things that can be great for sleep can be maybe some kind of tea that can kind of relax you. A lot of people may like chamomile, or maybe you are a person that likes to take a bath, soak in a bath before going to bed, and that can kind of relax your body. Epsom salt, it has magnesium in it that helps to relax the muscles and
how do
everything.
you feel about melatonin? It doesn't work for
Yeah,
me. It doesn't put me to sleep, but I know a lot of people use melatonin.
yeah, actually, melatonin is great. I just was today talking with a patient of mine, and she doesn't have the greatest sleep, but I started her on some melatonin, very low dose, and yeah, she's responding really well. We have her looking at her just nightly routines, what she's doing, trying to, like I said, avoid that blue light, cut off the lights, get in a routine of getting in the bed at a certain time. And also in the morning, like getting that first sunlight, going outside for about 15 or 20 minutes to get that sunlight to get your body's hormones back in balance. The melatonin and cortisol, like try to get that back balanced. So yeah, you might just
Well,
have that out of balance.
that's the issue. I don't go outside at all. Like I work from home. I go outside to take the trash out and check the mail. I got
Yeah.
so I mean it sounds like everything you said are my issues. I mean I go I listen to the TV because I like to have white noise on when I'm going to sleep. So I got a
Mm-hmm.
lot of things I need to work on apparently.
Mm-hmm.
But no, like
Yeah,
I
it can
feel
be
though.
a combination. It can be a combination of those things, and maybe your, hormones just are out of balance, and so you might could benefit from doing some more testing, looking at that. Yeah.
No, speaking of hormones, though, hormones are a pretty big trigger for a lot of people that I know with hidradenitis suppurativa, and and I tell people all the time, like, I mean, it sucks no matter what your trigger is, but I feel like the fact that my trigger is like my insulin levels going up or my food type of food that I eat, it's
Yeah.
a lot easier to control. I can control my insulin and food pretty easy. But like if hormones, like people who flare because of their on their cycle and they like just not really much I can do to way to help them because it's just a part of life. You know, how do I guess what is something that they could do, or like how could functional medicine help them with that? Because like, you know, your cycle flow gonna come, like unless you reach a certain age or something, like, you know, it's just a fact of life.
Yeah. Yeah, that's a good question. Even like with autoimmune, like a lot of people flare during like times of hormonal changes. Maybe you're going into menopause, or you're just, beginning your menstrual cycle, or maybe you just had a baby. So yeah, we can't prevent those things, right? We can't prevent our cycle starting, but some things that you can do is just know that that's coming and support your body around those times, like as you're getting near to the time of your cycle starting. Maybe supporting your body and getting, support for your body being stressed. So it could be getting the sleep that you need. It could be like really paying attention to your diet around these times. It can be like really trying to work on the stress that you're under, managing your stress around these times. So that's the first thing that comes to my mind, is just really giving your body some extra love and attention around, the time prior to you starting, and even after as well. And seeing if that makes any difference, because you're right, we can't kind of stop our cycles or these menstrual changes, or these hormonal changes that happen in our life.
You know, makes sense. So with functional medicine, like how long does it normally take for someone to start seeing results? I'm pretty sure, you know, it can vary, but
Yeah.
like how long does it take to begin to take root?
Yeah, definitely can vary depending on, what it is that you're dealing with, how long you've been dealing with it. But simple changes, people don't realize how important those simple things that we just talked about. I say they're foundational changes: working on your sleep, working on your stress, working on nutrition, like just implementing things like that. You might see a decrease in your flare just in a month or 2 months. But, digging deeper and getting to that underlying root cause, it can take much longer. It can take up to 6 months. It can take more. It just varies person to person. But yeah, you can definitely see some improvement, I would say, even in a month, with doing just those foundational things.
Love that. So we like to be improved. But I mean, even with medication, right? Like it doesn't happen overnight.
Right,
You know, people are taking these biologics and you take them for some time before it actually, you know,
right,
starts working. So everything
right,
takes can take time. So
right.
you have to be patient with yourself and your body.
Right. And it takes time to get your body back in the proper balance. So, yeah, and not to get down when things don't, because healing isn't just a straight line, right? It's not linear. Sometimes you may feel like, oh, I'm making some progress, I haven't had a flare, and then you might have a flare and you be really hard on yourself and down. But that, we're still working on supporting the body and improving and trying to, prevent that. So yeah.
Love it, love it. So what's something that let's see, what gives you hope, you know, when you're treating someone with a chronic illness? You as a provider, like what? Okay, this is going to give me some hope with treating them.
Yeah, the one thing that gives me hope is someone who has a mindset in knowing that this doesn't have to be the end. Like they really do believe, and I work with them, and this isn't the end. There is hope for me. And then I'm able to better work with you towards getting you relief, getting you answers, because you have already worked on that mindset. You're willing to put in the work. It's not something that's just going to happen without work. It's not something that's just going to happen overnight, like we just said. You can get down if you don't, see progress continually. Maybe you see progress and then it dips and then it goes back up. So someone who is like willing to put in the work, has the right mindset, that makes me happy because I can work even more with you. If it's someone who doesn't have the right mindset, I can work with you, but I'm going to be, kind of pulling a little bit more, right, to try to work on your mindset. If you're coming already ready and having the mindset like, I've been struggling with this, I am looking for answers, I am willing to do the work, I am willing to work along with you and, try different things and know that it's not going to happen overnight. And it might take some time, but ultimately in the end, I can be able to get some relief and get some answers to what's going on in my body and be able to enjoy some time with my kids that I haven't been able to do in a while. Like I feel like that's everything. So that makes me happy. Because I know so many people have been dismissed, like you said, and then they are defeated and they just feel like this is it. But if you still have a little glimmer of hope, then I can work with you. And yeah, so that makes me happy.
No, I love that. And I agree with you. It's hard to work with someone when they come in with the mentality already defeated. Because
Yeah.
Now you got to work on two aspects. Like I got to try to convince you that this is going to work so that you do it. Because people will be like my mama, they'll have to do something. They're like, okay, the doctor said do this. And then she'll do it to the point where she's like, oh, I feel better. Or, no, you got to finish the process. You got to finish it all the way through. Or you just were like, oh, you do it for a couple days, but you don't see any results. And then you just like, okay, I knew this wasn't going to work. And so very much of a mental thing of the self-fulfilling prophecy, right? Of like, you don't think you're going to get better. A lot of times, I mean, the brain is a powerful thing. If you think you're not going to get better, okay. Like that, there's a good chance that you won't. And so that the mindset plays a huge role in, at least in my opinion, of healing.
Right.
And, so
And that's a place where I start with many people is mindset. Like from the very beginning, when we first start working, like this is what I want you to do. Like let's journal, take 5 minutes and journal your thoughts, and really working on that to be sure we're more aligned as well. So yeah, it's huge.
Y'all, okay, so functional medicine is gonna give you a doctor or a nurse or practitioner. You're getting a therapist. You're getting a nutritionist. You're gonna work on a lot of things. But I love that. Like it's treating, and I talk about this all the time. Like I've spoken with a couple different dermatologists at events and stuff. Like treating the whole person. That's very big, and a lot of times, like that's the issue that I see with a lot of warriors who have some type of disdain with medical professionals, or they just said they haven't been to the doctor or dermatologist or whatever in years because there's just no point. People want to treat a symptom, or they just want to tell you this is what it is, not focusing on the whole person. Or they give you a diagnosis and they, walk out the room, and now, okay, you told me medically, but now I'm dealing with this whole mental mind aspect of it. And so like having somebody who's going to like not only say, okay, we looking at the root cause, but let's focus on your mind, because you got to wrap your mind around it first. And then we can, start treatment. And so that's very important. I love it.
Yeah. You're not your diagnosis, right? People say I'm not RA or I'm not HS. Like you are so much more than just your diagnosis. We are treating the whole body, the whole person, not just the diagnosis. So yeah, everything that comes with this person, who they are, what's their lived experience, what is their daily life like. Looking at all of that.
So what would you tell someone who kind of feels like their body is betraying them? Like I feel like I've had that thought, a couple times. I've gotten better with it, but especially early on, I felt like my body was betraying me. And it was kind of like, it was irritating in a sense, right? And I talk about this because, I like have a conversation with the Lord, and I'd be like, listen, you healed, all these people in the Bible, like they found healing. I can't find healing. And so like it made it for me, I felt like my body was betraying me. I felt like God was betraying me. Like it was this whole crisis with dealing with, on top of dealing with this chronic illness. And so with a little message of hope, like how would you?
Yeah. First, I would say you're not alone. You're not the only one to feel like your body is betraying you. And it's okay to acknowledge that you even have those feelings. Like acknowledging that is totally fine. But then knowing that it's not betraying you, it's really doing what it can to protect you. It's screaming out for help. Um, the time of flares is trying to see something going on. That immune system can see something as an invader or a threat, and it's trying to protect you, just going into overdrive and causing more inflammation and your pain and your other symptoms. It's really just a sign that something is going on in your body. Something's not functioning properly. Something is not properly balanced, and we need a little help. We need to dig a little bit deeper and see what it is that's going on. It's not anything that you have done yourself. It's not anything that, why did God create me like this? It's just something that your body is saying something's not functioning properly, something's not balanced. We're working a little bit harder to correct this. We need a little help. And so seeking out someone who actually hears you and doesn't just dismiss you and say that, okay, you come in and all your laugh look okay, so it's nothing that we can do. Really saying, okay, your laugh look okay, but it's not matching with what you're saying you're experiencing. So let's dig a little bit deeper and see what's going on, because I know you're not lying, right? I know if you're saying that you are having all of this
Okay,
pain.
thank you. That's the word right there. Like I know you're not lying. Like because
Yeah.
I my story, like I had a doctor tell me, he's like, I think you're a hypochondriac, sir. I promise you, there's something going on.
Yeah. Unfortunately, people are told that. I've had someone tell me that as well, like, or you're just making this up. It's all in your head. Like you need to see psych. Feel like they've been told or labeled as a pain seeker. It's really unfortunate. It's really heartbreaking when you think about it, that you're going somewhere to seek help for something that's going on in your body. You're not sure what it is. You're already feeling isolated. You feel like you're the only one. No one understands this. And then I'm coming to you like a medical doctor who's been trained and is supposed to help me, and then you just say like you're a hypochondriac and like nothing is wrong. Yeah, it's heartbreaking for me. But yeah, when your body is telling you that there's something going on, and we just need to dig a little bit deeper to see what that is, to try to get things back on track.
No, I love that. The thought that, your body isn't betraying you.
Yeah.
And that it is trying to protect you. Like you said, it's
Yeah.
something. I'm trying to sound the alarm the only way I know how. And that might be with, a boil-like abscess on your skin. I'm sounding the alarm that there is something going on internally, and I need you to focus on that. And a lot of times, it can be an irritant of like, oh, like, look what happened to my skin. But it's like your body, I can't talk to you any other way. Like, I'm trying to get a message across. And so I love that. Like, I'm not trying to betray you. I'm trying to help us the best way I know how.
Yes. Yeah. I love that sounding the alarm.
Yes. Oh my goodness. Thank you. This has been therapy in itself. Like, I mean, I love the validating patients and meeting them where they are, whether they jumping in cold turkey to a lifestyle. I say diet, but you're right. It's a lifestyle change, because when you deal with chronic illness or you have HS, which there's no known cure for, it's not a diet. Like either you're going to do it for the rest of your life, or you're going to fall out of remission, right? And so of like meeting people where they are, treating the whole body, and understanding that it's not your fault. There's nothing that you did to deserve it, but what we can do is work through it. I love that.
Yes. Thank you so much for having me. Like, this was so good for me as well. I appreciate you even just inviting me here to be with you.
Thank you. So real quick, again, if you can say where you're working at. I'm in Florida, so a lot of people who will like get this like locally will be in Florida, but Florida, Tennessee, and was there another state that you work in?
Right now, just Florida and Tennessee. So I practice as a nurse practitioner, and we are licensed in specific states. We can only practice in these specific states. I'm actually licensed in some other states, but it's so funny. Every state is different. Some states you cannot practice independently. Some you have to have a doctor that you work with. And in those other states that I'm licensed, I don't have a doctor at the moment. So currently, practicing or welcoming patients in the states of Tennessee and Florida.
Okay, perfect.
Yes.
And somebody wanted to reach out to you in Tennessee and Florida.
Yeah.
Is there? Well, actually, in the video, if you go to the description, I'm going to have her information. I'll get her information so that you guys can find her on Instagram. I'm sure she got a website, but you'll be able to find her to get some healing.
Yes, so the name of my practice is a virtual practice. So you can be anywhere in Tennessee or Florida. It is Functionally Balanced Health. I do have a website at www.functionallybalancedhealth. I am on Instagram and Facebook at Functionally Balanced Health. And that's how you can connect with me. I would love for you to connect with me on social media. Would love for you to connect with me through my website. If you go to my website, along the top banner at the right, it will be something saying book now, and we can have a free consult call where I will learn more about, what it is that you're dealing with. Where do you want to be? How do we work together to get you where you want to be? And that's a free call. No strings attached or anything like that. So yeah, I would love to connect with you. You can even join my newsletter from my website, and there you will get more information from me, tips, information when I have any kind of offers going on. So yeah, definitely, I would love for you to connect.
I love it. I love it. So this has been great. Again, thank you for joining and helping educate the community on other alternative routes that they can go to find healing and to get their whole body in line.
Yes, yes. Thank you so much. I really do appreciate it.
Right.